Namaste.
Namaste.
I am Dr. Kolla Vinod, Consultant Pulmonologist, Rashtrotthana Hospital, Rajarajeshwari, Nagar.
I am Dr. Sunil Kumar, ENT Head Neck Surgeon, Rashtrotthana Hospital.
So, on the occasion of World Sleep Day, we will be discussing about sleep apnea.
Sir, I have a question. What is sleep apnea?
So, sleep disordered breathing consists of repetitive episodes of apneas or cessation of breathing during sleep or hypopneas, decrement of airflow during sleep. So, these sleep apneas can be obstructive or central. Obstructive sleep apneas are when there is respiratory effort but there is no airflow.
Now, the question is how many of you have really slept properly in your lifetime or whatever in your day-to-day life? Do you know that all of you snore when you are sleeping overnight? There are some risk factors for your snoring and for your sleep disorders. Sir, can you just tell one sleep disorders risk factors or no? Few?
A few of the risk factors for sleep apnea include obesity, body mass index greater than 30, neck size, collar size greater than 17 inches in males and greater than 16 inches in females. And coming to the upper airway anatomy, you can...
Yeah, that is very rightly pointed out. See, this airway, we divide it into upper airway comes under ENT and the lower airway comes under respiratory medicine. So, we both are here to deal that airway which is concerned with sleep apnea and sleep disorders. So, upper airway mostly includes nose, oral cavity and neck to some part. So, whichever is blocking your nose, for example the septum, nasal deviation we call it as, or in children it is called adenoid tissues which are very much likely to happen because of lot of allergies in the nose. These are the conditions, and in oral cavity, tonsils which are going to bulge out in your oral cavity and lead to airway obstruction. Coming to the respiratory part, sir, can you just give us few respiratory things in which the obstruction can happen?
Some endocrine disorders like hypothyroidism, PCOD, and some genetic disorders like Treacher-Collins syndrome, Down syndrome, and excessive use of alcohol, sedative or hypnotic drug use can also cause sleep apneas. So, coming to the symptoms, we'll have choking or gasping episodes during sleep. You can have repeated awakening during sleep, repeated awakening for urination or nocturia during sleep, and witnessed apneas, unrefreshing sleep, early morning headache, excessive daytime sleepiness. All these are symptoms you can expect in a case of sleep apnea.
Yes. Now, coming to the part of management, how to manage this kind of sleep disorders. There are two types of managements. One is a medical line management which will be dealt by the respiratory physician, and the surgical management by ENT surgeons. Sir, coming to respiratory medicine part of medical management, what is the thing which you suggest for the people with sleep disorder in respiratory medicine?
First, we'll start with conservative management by lifestyle modification. We'll encourage the patient to reduce weight, increase physical activity, to change his diet, and to change the posture during sleep. So, sleep hygiene is very important. And coming to medical management, you have some devices which are non-invasive devices like a CPAP, continuous positive airway pressure, which provides a constant pressure during inspiration and expiration to prevent collapse of the airways during sleep. And coming to surgical management,
there are some surgical modalities where we can correct this kind of snoring disorders. In that, primarily we divide this snoring part into levels of blocks, in which level 1 and level 2. Level 1 is from the nasal obstruction, where we can do surgeries like septoplasty for the nose to relieve the block, or adenoidectomy for the tissues which are behind the nose, and in the oral cavity, tonsillectomies and UPPP. There are advances in these techniques where we do surgically resection of those excessive tissue and allow the airway to have a good volume to breathe. Coming over to the respiratory medicine part, what are those machines or instruments which you are going to suggest them for sleep disorders, sir?
Yeah, basically there are non-invasive machines like a CPAP or a BiPAP. BiPAP can be used when a sleep apnea patient has excessive carbon dioxide also or type 2 respiratory failure. This is in patients with chronic sleep apnea, but in patients who have mild to moderate sleep apnea, we can use a CPAP device, which will improve the quality of sleep and quality of life of sleep apnea patients. So it is a mixture of both medical and surgical management. First, we try with medical management, and then we go if symptoms are not coming down or if there is any issue in the upper airway anatomy, then surgical management is the preferred choice.
And there is always something called sleep study where we put you across for sleep to study about each and every individual if they are suffering from sleep disorder. Sir, can you just highlight what is sleep study in few
So
lines?
there are 4 levels of sleep studies, level 1, 2, 3 and 4. And it consists of many channels which include the ECG, EOG or the electrooculogram, electromyogram and electroencephalogram. These are all present in the level 1 and level 2. Whereas level 3 and level 4 contain channels to measure your oxygen saturation, heart rate and 2 other channels for your respiratory effort. Basically, sleep study is done to determine the apnea hypopnea index or the AHI index in people with sleep apnea. Less than 5 is normal, and depending upon the severity, it will be 5 to 15 is mild, 15 to 30 is moderate, and greater than 30 is severe. So depending upon the severity, we have to go for either medical management or surgical management in a particular set of individuals. So if you have any issues regarding your sleep, as sleep is one of the most important thing, good sleep, you will have a good morning. So you can consult the pulmonologist or the ENT specialist in Rashtrotthana Hospital, Rajarajeshwari, Nagar. Thank you.